Hello and welcome to the Logic Club educational videos. My name is Rubina Parvez. I'm Strategic Application Specialist for General Imaging. In this session I will go over B-mode and colour flow optimization for the Logic S8. Okay, we're going to start off with B-mode. Having selected the correct transducer and model for the application that I'm going to do, I will talk over some of the things that you could change when you are scanning. So I'm only going to go over the main parameters as opposed to all the parameters. Harmonic imaging increases image clarity and tissue contrast by reducing noise and clutter within the image. So at the moment I'm scanning, I have an image on the screen with harmonics. If I take harmonics away, you can see that it's a very noisy, speckly image. The borders aren't defined at all in this. If I go into harmonics, it does a fast cleanup job for me. So it's worth looking at harmonics and trying to see what works for you and what doesn't. Especially on the difficult patients, you'll find that it will reduce your clutter and give you a cleaner image. The second thing that you can look at when you are scanning is the frequency. Obviously, the bigger the patient, the lower you want to go down in penetration, so that you will need to reduce your frequency. I have an ideal model, so in my case, I will be going up in frequency just to show you the difference. So 5 is the highest frequency on this transducer, and you can see on the monitor itself, it tells you that I'm using 5 megahertz. But just look at the image when I reduce the frequency. So this is 4 and 3. So 3, the resolution isn't as great as 5, but if I had a big patient, you would actually see the difference in the fact that I could get further afield. So that was your harmonics. You also have independent frequency change in B mode as well. The third thing you can look at when you are scanning is dynamic range, and this is displayed on your monitor here as dynamic range. This is your signal to noise ratio. A higher dynamic range setting will bring in more low-level echoes and give you a softer, smoother image. A lower dynamic range will give you a more contrasty image. So if you have a big patient, you will want to reduce that dynamic range just to clean out the image. And a slimmer patient and a smaller patient, you will want to go up on dynamic range. So let me show you what the impact of dynamic range has on this patient's liver. If I go up in dynamic range, you can see my image is getting softer and smoother. I can afford to go up to 90 here. If I come down, as I come down, it's a bit more contrasty, a bit more black and white. I'm getting rid of low-level echoes. You want to be very careful that you don't go down too much in case you lose real information as well. So just a note of warning, on a bigger patient you can afford to go down to 60 dynamic range. On a slimmer patient you can go into the 70s. I can take it up into 70 for him. Crossbeam is my spatial compounding. It is a process of combining 3 or more frames from different steering angles into a single frame, the benefits of which are to reduce clutter and noise within the image, thereby improving contrast resolution. This is better for better detection of calcification, biopsy needle visualization, and cystic boundary definition. Coming back to the liver again, this is the image with crossbeam on. This is the image without crossbeam. Actually on this, it's not making a big difference, but it does make a big difference on a patient that is a bit more challenging. But you can still see from here, when I put crossbeam on, I'm actually increasing my contrast resolution within this image. And finally, the other main component I would probably want you to look at changing is SRI. SRI is an adaptive algorithm to reduce speckle, unwanted speckle within the ultrasound image. And on the system, on the touch panel, you have SRI, and at the moment I'm using an SRI of 3. If I go down to 0, you can see my image is very speckly. I've brought in all the speckle within the image, and it's not as aesthetically pleasing as it was at 3. If I go to the other extreme, which is 5, you can see that this is too much smoothing. It's beautiful for definition of boundaries and borders, but almost artificial looking. So I do prefer this middle of the road. 2 to 3 is ideal for day-to-day scanning. Now, if you're not used to speckle reduction, then I would recommend that you actually do a dual side-by-side comparison. If you press your left and right dual button simultaneously, you get a comparison. On the left side is the image that is unprocessed. On the right, you have the image with SRI. It gives you confidence as a user to understand what SRI is doing to your image, but also you can change the levels to see how much you're benefiting from this. So the important thing is you really need to understand what it's doing for you and what you're gaining from it. You're not going to lose anything, but there is a learning curve with SRI, especially if you're not used to it. If I go back to single image by pressing my B mode, I'm back to my single scanning. Some of the other parameters that you could look at here are on the touch panel is your edge enhancement, your frame average, which will also smooth out your image as well. You've got grey maps that you can change and line density. All of these make a minor difference to your image, but will have an impact on it. A couple of tips I can give you. If you have an image that is too grainy and you want to smooth it out a little, you can increase your dynamic range. You can also increase your frame average to smooth out the image and take up your SRI to another level. If you have an image that is too soft and you're showing too many low-level echoes and you want to make it a little bit more contrasty, you can take down the dynamic range by reducing it a little. You can take down your frame average as well, and you can take up your edge enhancement. If you have an image that is too noisy, there you may want to actually take your dynamic range down, take your gain down as well, and take up your frame average. And finally, on patients that are technically challenging or difficult to scan, you will want to change a few more things. You will want to make sure that you have the correct probe that you are scanning with. You'll want to drop the frequency down to a lower frequency. Also, you will want to drop your dynamic range down as well, so that you are getting rid of the low-level echoes. And noise is a low-level echo, so you will want to reduce it in your image. Let's have a look at color. I'm sticking with the abdomen here, so he has a very nice and easy abdomen to scan. So I put on my color. I'm getting color. In the major portal, I'm getting color, but in the other vessels, I'm not. So one of the things that I'm going to adjust first would be my gain. I take my gain up to a level where I introduce noise within the image, and then I back off, and then I know that I have optimum gain. Secondly, what I will do probably is to, in this case, decrease my PRF slightly, or scale, just to get a little bit more color. And you can see how I've improved the color in all the other vessels around the porta. To increase my frame rate in my image, although this frame rate is not too bad, if you look on the screen, frame rate is displayed at the top of the screen, and I have 10. The size of my color region of interest has an impact on frame rate. So if I want to adjust the size of the color box, if I look at my 3D mapping of my trackball and select keys on my monitor, I can see position is highlighted, so my trackball is moving the position function. But if I want to adjust the size, I press my button at the top, I can reduce the size, and it has an impact. So the width of the box has an impact on frame rate, not the height. So I would use a box that gives me enough frame rate, making my blood vessels appear hemodynamic. So adjust your color box to the required size so that you're looking at the vessel of interest as opposed to the whole area. So some of the things that you can do to optimize your color. One, to increase your frame rate. Obviously you've seen I've narrowed my color box to pick up my frame rate. The other thing that I can do is on page 2 of my touch panel screen, I have line density. I can also decrease my line density if I want to pick up frame rate. So my line density is my frame rate versus my spatial resolution. So depending on whether I want better temporal resolution or whether I want spatial, I can adjust the parameters accordingly. If I have too much color in my image, then I will want to actually reduce the gain slightly and increase my scale or PRF so that I don't get aliasing within the vessel. And I may also want to adjust my frequency accordingly. So if I was looking deeper, I would want to reduce my frequency. If I was looking more superficial, I may want to increase it for resolution. If I have an image that has too much noise or flash in the image, then again, I would start off with reducing my noise slightly, increasing my scale and PRF, reducing the size of my color box region of interest, but also on page 2 I have flash suppression also, which I can actually activate and increase if I find that I'm getting too much motion artifact as well. One more thing that I need to point out to you, on the Logic S8 you also have, when you go into color, some shortcuts. If you are scanning an abdomen and you want to look at the renal, there is a renal shortcut, there is an aorta shortcut in there. Please utilize the appropriate flow patterns for the area that you are interested in. For more in-depth explanation of optimization for B mode and color parameters, please refer to the F1 Help online user manual. Thank you for watching and goodbye.